The Ministry of Health and by extension the Government of St. Kitts and Nevis instituted several critical reforms in the healthcare sector aimed at delivering quality, efficiency and excellence. Some of these reforms were highlighted on Wednesday's edition of In Focus by Dr. Jensen Morton, Director of Health Institutions, who noted that the reforms were done in collaboration with the entire health team that was established to take the health sector forward.
The first thing that we thought was really crucial was from the feedback from different members of the general public. The main complaint that seemed to come with regards to healthcare in St. Kitts in general, it can be boiled down to different aspects of customer service. So that was identified early, and we already started partnership with the relevant bodies to get customer service training on board. It started formally, excuse me, it started formally finally a few weeks ago with Mrs. Delcia Bradley King, and it's going to be something that we're going to incorporate into the regular let's call it indoctrination process of everyone that comes to work at JNF. We're also in discussion with CFBC to ensure that that aspect is also included with the nursing training even before you arrive at JNF, such that that aspect is well ingrained.
Dr. Morton added that the customer training sessions will be continuous and will serve as a refresher course because this is, quote, what we do to ensure that at the end of the day, the patients, their relatives, etc. are cared for properly, end quote. He said another initiative taken by the Ministry of Health pertained to basic life support and advanced cardiovascular life support training for numerous staff members.
Essentially, the thought process was that if any emergency was to erupt in any part of the health institution, that regardless of the staff member that is present, that they can at least assist with the resuscitation of that patient. That is the end goal.
He said approximately 220 workers have since been trained, some in basic life support, some in advanced cardiovascular life support, and others in pediatric assistance life support.
Since then, we've also been engaging in some subsequent training, leadership training for the nurse managers and assistant nurse managers, leadership training for the physicians, training for all of the clerical staff with regards to having full understanding of all aspects of medical terminology such that everyone's on the same wavelength, whether you come from a science background or not. Excuse me. So those were our investments with regards to different parts of the human resources, because that was something that was really important.
Dr. Morton addressed the assignment of a group of doctors to the Pogson Medical Center in Sandy Point to ensure that a doctor is physically available 24/7 at the medical facility. This measure is also expected to be adopted at the Mary Charles Hospital in Molyneux.